Hey mamas, today we're going to go over pelvic tilts. So pelvic tilts can be used to help with any back pain. Our pelvis is usually in more of an anterior tilt when we're pregnant because we have the baby kind of pulling us forward. It can cause a lot of strain on the low back. So pelvic tilts are a good exercise for that. They can also help improve circulation and then strengthen some muscles of the pelvic floor. So it's something that you can do during pregnancy, and some people may tell you to do them a little later in pregnancy if you feel labor coming on to help induce labor, help with the positioning of the fetus. But so what we're going to do is I'm going to show you two different ways to do it. I personally like to do them more on my elbows and knees because I can get a bigger tuck there, but I'll show you how you can do it in standing as well if this isn't comfortable for you. So first one, come onto your knees, and then you're going to bring your forearms down to the mat. Your hips are going to stay high into the air. And then from here, you're going to tuck your tailbone so that it starts to point down towards the floor, and kind of tucking your belly or gently hugging baby in towards you. And then you're going to release, hips go back towards the ceiling, belly drops. This is really similar to cat-cow, but I feel like I can get a little more into the pelvis doing this kind of approach. So again, you're gonna exhale as you tuck, and then inhale, you're releasing, hips go up towards the ceiling, tailbone goes up towards the ceiling. And then again, you're tucking that tailbone, kind of rounding the spine a little bit, and then releasing. So the reason I like to do the exhale when you tuck is because you can also get a little bit more into your pelvic floor. And you can gently lift up through the pelvic floor as you exhale and as you tuck. So in a previous video, I mentioned that when you exhale, your pelvic floor starts to draw up. So that's a perfect time to engage your pelvic floor rather than on the inhale. So the next way you can do it, you can also do it on your knees, but you can do it in standing. You can put your hands on your hips. So what you're going to do is tuck your tailbone. So that's kind of pointing down towards the floor. You're gently hugging baby in, and then you're going to release. So kind of taking an arch in my back here, and then I'm making that arch go away. So I'm tucking, and then my back is flat, and then releasing and tucking. So again, you can do it on your knees in that same way. So releasing it out and then tucking. So let me know if you guys have any questions with these, or if you're having any difficulties. Please feel free to let me know. I'd love to hear from you. Thanks.